Welcome to the video. Light has been an essential tool in the field of medical science for many years. And you know that different wavelengths are there in the light spectrum, and all wavelengths are not used in the field of medical science. So here in this video we are talking about only the infrared region and near infrared region. Infrared region and near infrared region. Near infrared region, this is in short called INR. Okay, IR and INR. IR means infrared region and INR means near infrared region. This is actually a range of wavelengths. So if you talk about infrared region, then it covers a range of 700 nanometers to 1 millimeter. Okay, 700 nanometers to 1 millimeter, this is the range of IR wavelengths. These are wavelengths, 700 nanometers to 1 millimeter. And within this broader range lies the shorter range, which is NIR. It spans from 700 nanometer to 2500 nanometer. Okay, and both are used in the field of medical science, both for imaging and for therapeutic uses, means for treatment. And other wavelengths are also there in the light spectrum, such as, or better to say, electromagnetic spectrum, such as UV rays are there, ultraviolet rays, then visible light rays are there. But here in this case, this IR and INR both are invisible to our eyes. Okay. And if you talk about those UV and the visible light spectrum, then those light spectrum means if you consider those things, then you know that wavelengths are very short for that spectrum and they carry more energy. But what happens when they interact with our body? In that case, most of them are absorbed by the water content and the chromophores, biological chromophores in our body. Absorbed. But requirement is what? Requirement is a deep penetration. Okay, and for deep penetration, higher wavelengths, means longer wavelengths are necessary. So this range is suitable for the use in medical science. Okay, this range means I am talking about 700 nanometer to 2500 nanometer, which is known as INR. Deep penetration is possible, okay, by using these wavelengths of light spectrum. That's why this is used. And this is less absorbed by water, and hemoglobin means I am talking about biological chromophores present in our body, less absorbed. So that's why deep penetration is possible. Okay, and you know that INR, if I talk about INR, then for photothermal therapy, this is used. You know that photothermal therapy using nanoparticles, it is required to heat up the nanoparticles. Okay, so by using this INR wavelengths or INR light, the nanoparticles are heated, and those heated nanoparticles are able to destroy cancerous cells, and it is localized. This heat production is localized, so thereby sparing the healthy tissues. Means healthy tissues are not harmed that way, since the production of heat is localized and the nanoparticles are used for that purpose. And in all these cases, only INR, that wavelength means 700 nanometer to 2500 nanometer, this wavelength range, this is used. Again, for INR, spectroscopy is there, where oxygenation levels in tissues are measured. Okay, and that is suitable for neonatal care, for brain monitoring. So in case of spectroscopy also, this INR is used. Okay, so there are various uses of INR, and if you talk about only IR, then in that case for normal injuries or any problem in your body, that IR range is used for imaging purposes. Okay, if you have any injuries in your body, in that case that range of wavelengths is used, which is known as IR, the broad spectrum, and broad spectrum of the wavelengths. Okay, and for normal heating purposes also, that IR range is used. Again, in case of physiotherapy, a part of physiotherapy is heat therapy. Okay, so in that case also IR is used. Means in that case only INR that is not required. The whole spectrum for IR, which ranges from 700 nanometer to 1 millimeter, that can be used for physiotherapy. Means actually here under physiotherapy there is heat therapy. Okay, so you can see that INR means and this is known as, in the field of medical science, this is known as biological window, because it helps many ways. Main reason is it is less absorbed by our body, means by our body's water content and the chromophores, biological chromophores. That's why this is known as a biological window in the field of biology or in the field of medical science. So you can see that there are various uses, and uses means both for imaging, that means diagnostics, as well as for therapy. Okay, for both the purposes light is used, and in most of the cases only INR, this is suitable. Okay, I have given you two examples only. One is INR spectroscopy, another one is those nanoparticles which are heated up by the use of those INR wavelengths. Okay, and there are more uses in the field of medical science. Anyway, so this was all about today's topic. Actually, what is the main topic of discussion in this video is that why not all the wavelengths are used for the diagnosis and treatment of different diseases. Okay, why not all the wavelengths? So you can see that for various wavelengths our body responds differently. Okay, so shorter wavelengths are not suitable for such purposes. Shorter wavelengths means I want to mean those UV and visible light spectrum, because most of them are absorbed by our body and scattered. But what is the requirement? The requirement is the deep penetration. Okay, anyway, so this was all about today's topic, and this is the end of this video. Thank you for watching this video.